Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and this is part 2 of our two-part series on carpal tunnel syndrome. And what I want to discuss today is two easy exercises you can do at home if you're experiencing some carpal tunnel type symptoms that really could help you. In the last tip, I want to go over some supplementation that just came out in some literature that is really fascinating that may also help. So the first exercise I want to demo is one we commonly give to our patients that have carpal tunnel syndrome, and it's very easy. All you need is a rubber band at home. So all you'll do is take a rubber band just around your fingers, just like this. And so what happens, if you remember discussing carpal tunnel, is this median nerve and wrist flexors are irritated. So what we want to do is down-regulate that. And so what you'll do is, right here, just flare those fingers out and hold it for 1 to 2 seconds and then come back in. And then we're going to go out and do it again. If you do about 3 sets of 10 twice a day with 1 to 2 second holds, what that'll do is activate the wrist extensors that'll help detone the wrist flexors and help alleviate a lot of that numbness and tingling that you may experience with the carpal tunnel. And it's very easy, all you need is a rubber band. The second one I commonly like to give my patients that I see with carpal tunnel type symptoms is, and I'm going to get seated for this one, is what we call median nerve floss. So once again, that median nerve is the nerve that gets irritated right down here into your thumb and in these 2 fingers typically. And so what we want to do is floss this nerve back and forth. What that does is it helps free up the adhesions along that nerve and help desensitize that nerve, so it'll really help alleviate the signs and symptoms. So what you'll do is, on your affected hand, I'm going to demo my right one. You want to start out with taking that tension off that whole nerve, while at the same time leaning your head away from it, so you tighten the whole nerve up here at the top of your neck. And so what it'll look like is you'll then floss that nerve just like so. You're going to lean your hand back and really flare those fingers out as you look down toward your hands. What you want to do is feel that pull as you go back, and then we're going to floss back just like this to the starting position and back out like this. What you want to make sure is go right up into that tension, but you should not experience any pain when you do that. If you do, you've gone too far, and that can exacerbate the symptoms that you're having. So just like a stretch, you want to go just until you feel it and then back off. Do 3 sets of 10 of those twice a day, and it can really help your signs and symptoms of the carpal tunnel. And lastly, the one fascinating research I just read, and the research is about supplementation of B6. And so we've all heard typically about the stress B vitamins, but particularly B6, they have found that if you take 200 milligrams a day, that it actually can reduce carpal tunnel type symptoms up to 68%. And so typically a lot of those that have experienced with the carpal tunnel syndrome signs and symptoms at night, that could be an easy way that can really help get you over the edge with the pain you've been experiencing. So once again, I hope you found these tips helpful. If you have any questions, please comment in the blog below, and we'd love to hear any feedback you may have. Have a great day.